Right now is an especially important time to teach about viral hepatitis, and there's a couple of key factors that are driving that. First of all, doctors don't know much about hepatitis. There's been a number of different studies that have been done that have shown that the information that physicians retain after their training is really low, and they're unable to answer some of the simplest questions about how to test for hepatitis and who has hepatitis and how many of their patients might have hepatitis. So that's, first of all, that there's a big need. Secondly, there's evidence that that lack of information is of increasing importance. It's of increasing importance, first of all, because a lot of patients with viral hepatitis don't know they have it, and they're not being tested by their physicians because often physicians aren't aware of those two facts, that a lot of the people that they're seeing for hypertension or diabetes or other medical conditions actually also have chronic hepatitis B or hepatitis C, first of all. And secondly, that there's better and better treatments. There was once a time when these viruses were first discovered and the treatments were really bad, that people would say, look, what difference does it make if I found that my patient had hepatitis, because I can't really do anything anyway. But now the treatments are improving markedly, and as the treatment success is improved, it becomes less and less tolerable to have patients walking around that have viral hepatitis and don't know it. So the convergence of these factors, the lack of information, the proven effect of that lack of information in leading to up to 2/3 of the people with chronic hepatitis not even being aware of it, and now the opportunity to treat and cure hepatitis C and treat chronic hepatitis B make it extremely important to expand awareness and understanding of chronic hepatitis in the United States. It's interesting that recently a paper was published that showed that hepatitis C itself killed more people than HIV in the United States every year since 2007. And that's an astonishing figure that is really not commensurate with the amount of education, the amount of understanding, the amount of testing that's gone into to chronic hepatitis. The other element of hepatitis C testing that's important to underscore is that at least 2/3 and up to 80% of the people with chronic hepatitis C were born between 1945 and 1964. So you have a very large fraction of the individuals with the infection, and especially those with the infection that don't know they have it, who all are in a fairly narrow age group. And those are the people that are actually most risk for some of the disease complications right now. And for that reason, many individuals, including the U.S. Public Health Service and the Centers for Disease Control, are beginning to strongly consider new recommendations that everyone in that age group be tested for hepatitis C at least once, to make sure they're not one of the silent carriers walking around who's at risk of having disease.